My name is Doug Dick. I currently live in Southern California. I'm currently working as a nurse. My wife's name is Stephanie. She's also a nurse. We've both been nurses for 38 years, but we've both been in the medical field over 40 years. So I have 2 kids of my own. My wife has her 4 kids. We now have, let's see, I gotta count. We just had another one, 13 grandchildren. So we're busy. 2020, of course, right after COVID hit, I was being worked up again for mitral valve repair when I developed congestive heart failure. I was in the hospital for 10 days for what they called severe congestive heart failure, CHF. And in the course of 10 days, I lost 20 pounds of fluid, which is about almost 4 gallons of fluid, which is hard to imagine, but sometimes, especially with CHF, it comes on gradually and it just gets worse and worse until it's treated. Initially, once I was discharged from the hospital, my cardiologist talked a lot about diet, and I think most people don't realize either A, how much salt they do add to food as a matter of habit, not so much as a matter of taste, and also how much sodium is already in food. And there are certain things that you can do and still watch your diet, like going out for fast food. We'll go for like a burrito versus going with like a hamburger and french fries. And I know when they put salt on fries, they put a lot of salt on it, and it makes a huge difference. And you can tell on how you feel because of the amount of sodium that you can get either through fast food or whatever you're eating. But for us, even at home, we make fries in our air fryer. A, it's better, it's easier, and we don't add salt. I've been pretty much controlled up until I went to CHF again about a year and a half ago. I was having some issues at home. I'm always taking my blood pressure every day. I check my weight usually every other day because I'm so concerned about gaining weight related to fluid retention. And usually the first question the doctor or the PA or NP will ask is, do you have any swelling in your feet? And I literally check mine every day to make sure that it's not getting worse. And when it does, I call the office, which is what happened this time. It's like, I'm starting to get some increased swelling in my feet. I'm up 3 pounds, which I kind of freaked out a little bit about that. And the only thing I can think of the whole time is like, oh my goodness, they're going to readmit me to the hospital. And he goes, no, we have a new treatment. I said, what are you talking about? He goes, this treatment, FUROSCIX, is a delivery system for your furosemide where you can do it at home. And that's like, as long as I don't have to go in the hospital, I'm all okay with that. Well, and I understand, even as a nurse, people don't want to be in the hospital. And even as a nurse, I don't want to be in the hospital either. So if I can stay in the comfort of my home and still have treatment, it is like night and day. Using FUROSCIX is literally a game changer. Your doctor or cardiologist have mentioned going on FUROSCIX. I would highly recommend it for many, many reasons. A, it's very simple. It's not frightening or scary. You don't really have to do anything technical while you're at home. And anything that will keep you out of the hospital in the comfort of your own home, that's always a plus. If I had to do it tomorrow, I would still do it because I know that it's safe, it's easy, and it works.
What is FUROSCIX, furosemide injection, for subcutaneous use? FUROSCIX is a prescription medicine used to treat fluid buildup, which can cause congestion or swelling, also known as edema, in patients with chronic heart failure or chronic kidney disease. FUROSCIX should be replaced with oral diuretics as directed by a healthcare provider. Follow the instructions provided by your physician when taking FUROSCIX. Important safety information. Before taking FUROSCIX, read the instructions for use and tell your healthcare provider about all your medical conditions, including if you have trouble urinating, are allergic to furosemide, or any of the ingredients in FUROSCIX, or if you are allergic to medical adhesives. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. FUROSCIX and other medicines may affect each other, causing side effects or change how the medicines work. What are the possible side effects of FUROSCIX? Dehydration. FUROSCIX can cause you to lose excess water and electrolytes. Symptoms of excess water and electrolyte loss include dry mouth, increased thirst, muscle pains or cramps, decreased urine output or urine more yellow than normal, headache, dry skin, nausea, or vomiting. Your healthcare provider may check your electrolytes while receiving FUROSCIX. Low blood pressure. FUROSCIX may cause your blood pressure to decrease temporarily. You may feel lightheaded or dizzy, particularly when standing up. Getting up slowly may help. High blood sugar. If you have diabetes mellitus, FUROSCIX may increase blood glucose levels. Loss of hearing. FUROSCIX can cause ringing in your ears. Tell your healthcare provider if you have trouble hearing while taking FUROSCIX. Incomplete dosing. If you do not receive a full dose because the on-body infuser got wet, came off the skin, or there was an alarm, call your healthcare provider for more instructions. Do not apply a new on-body infuser unless instructed to do so by your healthcare provider. The most common side effects with FUROSCIX are administration site and skin reactions, such as bruising, redness, swelling, and infusion site pain. These are not all the possible side effects of FUROSCIX. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Please see the full prescribing information, www.furoscix.com/prescribing-information.pdf, and use instructions for use. www.furoscix.com/instructions-for-use.pdf.